Yoga for preventing asthma. First asana is Sukh asana. The procedure of this asana is sit erect with your feet stretched out in front of you. Now cross your legs such that your knees are wide. Shins are closed and each foot is placed under the knee. Your knee must be bent and your leg should be trunked into your torso. Your feet must be relaxed and the outer edges must be rest on the floor, while the inner edges must reach on your shin. When you look down on your legs, you must see a triangle formed by your shins that are crossed and both your thigh. Your back must be balanced in such a way that the tailbone and pubic bone are at an equal distance from the floor. Tailbone, it means last edge of our spine. Now that your feet are in their place, you can place your palms straight up on your lap. You can also lie them on your knee, palms up or palms down. Just make sure that you alternate that crossing of the legs. You can keep your right leg over your left or even days. Some benefits are it spreads a sense of calm and peace through your mind and body. It relaxes the brain. The body alignment is improved. Asana help enlighten your spine, back becoming strong and stretched also. Contraindications of Sukha Persons suffering with joint problems like knee or ankle should avoid this asana or be careful while doing this asana. Next asana is Chakrasana. Procedure of Chakrasana is lie flat on your back on the floor. You may bend your knee or that the soles of your feet are on the floor and closer to your buttock. Make sure that your feet are hip width apart. Your hand must be placed behind your shoulders, ensuring your fingers are opened up and pointed towards your shoulders. Once you feel comfortable in this stance, balance your weight on your limbs, then press your feet and palms and lift your entire body off the mat. Let your hands hang gently. Make sure your breathing comfortability. Take slow and deep breaths. Hold the pose for a minute or for as long as you feel comfortable. Some benefits of Chakrasana are increases the flexibility of the spine and tones up the muscles of the whole body. Cures kyphosate and asthma. Cure digestive problems, constipation, gastric, piles, diabetes. Prevents hernia, kidney pain. Next asana is Gomukhasana. It is also beneficial for asthma. The procedure of this asana is being by sitting in cross-legged position. Bring your right foot onto the top of the left thigh and slide it as close to the hip as possible. Bring your left ankle by the side of the right hip. Try to make sure that one knee is over the other. Slide both your feet far behind, but make sure your comfortability. Try to keep the spine straight and vertical and the head facing forward. Raise your right arm and bring it over your shoulder. Wrap your left arm behind the back and reach to grasp your left hand with the right hand behind the back. Some benefits of Gomukhasana. It stretches your hip, provide power to your ankle, thigh, shoulder, armpit, chest, deltoid and tricep. Relieve chronic knee pain. Strengthen your spine and abdominal muscle. Strengthen the hip joint also. That's it. Next asana is Parvatasana. Procedure of it: sit in a Vajrasana pose and keep your spine and neck straight. Close your eyes gently and inhale, raising both the hands above the head. Join the palms in Namaskar Mudra. Elbows should be straight and hands stretched upward. Return to the normal position while exhaling. Some benefits of it: improve posture, strengthens the muscle, decreases anxiety, prevent respiratory problems, strengthen the muscles of the arms and leg, increases blood flow to the brain and gives a mild benefits. Similarly, inverted asanas. Contraindications: avoid this asana if you have any waist, hip or ankle injury. That's it. Next asana is Matsya Asana. The procedure of this asana is: begin with the Savasana. Maintain a flat back. Make sure your arms are straight with the palms slide out on the mat. Gently bring your palms under your buttocks. Tip your hands backward slightly with your toes resting on the floor. Hold for a minute of 30 seconds. Inhale and use your forearms to lift your chest, shoulders, upper back and head off the mat. Bring the top of your head to rest on the mat and hold this position for a minute or 30 seconds. Then return to the normal position, relax and inhale. Repeat the procedure 6 to 8 times. Some benefits of Matsya Asana. This asana strengthens the respiratory system, beneficial for patients suffering from asthma, chronic throat problems, stimulates kidney function. Contraindications: this asana should be avoided after the abdominal surgery and by hernia patients. Avoid this asana if you are suffering from problems of the cervical spine, high blood pressure. Bhujanga asana and Paschimottanasana we have discussed in earlier video. Please see that.